This month is National Pancreatic Cancer Awareness Month, and there is emerging technology that might be helpful. Dr. Debashis Bose from Mercy Medical Center is joining us this morning. Good morning, Dr. Bose. Thanks for being here.
Good morning. It's a pleasure. Thanks for making time for us.
Of course. We'll talk about some of the symptoms of pancreatic cancer.
Well, unfortunately, symptoms of pancreatic cancer arise when usually the disease has already progressed quite a bit. But one of the most common things we see is that people develop what's called jaundice, where, the eyes go yellow, the skin can get yellow, and that's because of a blockage of a duct called the bile duct, which goes from the liver to the GI tract. And what happens basically is you back up bile into your bloodstream and you turn yellow or become jaundiced. Weight loss is also very frequent, and sometimes abdominal pain, right sort of in the upper abdomen, in the middle of the upper abdomen, kind of under your breastbone, but above your belly button, so to speak. And those are some symptoms that probably need to get checked out anytime that happens, especially if it's not going away or doesn't have some other good explanation.
What's some of the testing that's involved in that?
Well, one of the biggest things to get done is to have, lab work drawn, of course, and then to have imaging done. And that would be things like CAT scans or MRIs, or even sometimes ultrasounds can pick these sorts of things up. But really, the main thing is not to ignore the symptoms and to go through a full, what we call workup, a full set of tests.
And so you're actually involved in a study regarding some new technology. So can you tell us about that?
Absolutely. So the study we're talking about is called the DIRECT study, and there's actually two parts of it. But basically, what it does is it examines whether or not the use of a device called commercially the NanoKnife machine, which uses a technology called irreversible electroporation. A lot of big words there, but basically it's a way to kind of zap a tumor, right? But what happens is some patients with pancreas cancer can have a surgery to remove it. We call that resectable disease. Other patients have, unfortunately, disease that has spread to other organs. And in that case, surgery is often not a good choice because it doesn't really help. But there are some patients who fall in the middle where the tumors are involving important structures like blood vessels and therefore can't be necessarily removed right off the bat. So for those patients, we treat with them with chemotherapy and with radiation, and then we hope to try and get them to surgery. What NanoKnife does is it allows us to treat areas that we're worried that we can't completely remove and treat it without damaging those structures, those blood vessels or nerves or tubes or ducts or things like that. So what we do is we put needle probes in and create an electric field in the area that we want to treat. It can kind of be thought of as another effect of like radiation. It's not radiation, but it does the same thing, and it can be done in an area that has been radiated. So it gives us another way of getting better local control over the disease. The study looks at whether or not folks can get this and get benefit. The technology is already FDA approved for the quote unquote ablation of soft tissue tumors. So it's not experimental in that sense. But really what the study looks to do is see, are we providing benefit in terms of survival and symptoms from pancreatic cancer for patients who otherwise wouldn't be able to get a surgery to remove it.
And in 30 seconds or less, what are you finding so far?
Well, the data so far from selected studies shows a very good benefit. Most patients will live using this technology for the right patients. Median survival is 2 years. Now, that doesn't sound great, but without it, our median survival was more like 14 to 16 months. And those are statistics. So you have to remember that for some patients, this technology is giving them even longer term survival. And I can tell you just from experience, having done this for a few years, I had a patient who I did it for the first time in 2016. That gentleman has no evidence of disease today.
Wow. That, as a doctor, that has to be pretty amazing for you to have been a part of.
Oh, I'm just grateful to have some tools, something to offer, right? It's just
Absolutely.
another thing to offer.
And technology continues to emerge, and you're a part of all of that. Dr. Bose, thanks so much for joining us. Really appreciate it. Some great information this morning.
Thank you so much for having me.
You're welcome. Take care and stay with us.